Hey, good morning, everyone. My name is Peter Kelly, and I'm here on behalf of the Department of Education representing the Center of Excellence for Health. This is our second session of our annual Allied Health Week, and today our session is on respiratory therapy. So today we have with us Bradley Hambrook, who is a registered respiratory therapist with Horizon Health Network and works in the Upper River Valley Zone. Bradley has been a respiratory therapist since 1988 and has started his work at the St. John Regional Hospital and came to Northwestern New Brunswick in 2001 to work and raise his two boys, one who is now a teacher at a high school in Alberta and one who is a researcher and professor at the University of Alberta. Part of Bradley's duties as a respiratory therapist has given him the opportunity to fly in a Chinook helicopter and a Zodiac rescue boat, which that sounds really interesting. Can't wait to hear more about that. So welcome, Bradley, and the floor is yours.
On sound works better. Thank you very much, Peter. So as Peter has started out by introducing me, I'm Brad. I'm a respiratory therapist. I'm originally from the Miramichi, so if I have a little bit of an accent, comes out every so often, bear with me. I'm 58 years old, and as you heard, I've been in this profession since 1988. I started studying then at the Victoria General Hospital in Halifax, and at that time, it was the only school on the East Coast. Since then, there are schools that you can study my profession across Canada in all provinces except PEI, and I believe Manitoba doesn't have a school this either, but you can study in every other province. For me, it was a career option. I went to university at UPEI after I graduated high school, and I really didn't know what I wanted to do. And just so happened that when I was doing a school placement, like you guys call it a C program nowadays, it was a student summer employment program back then. I worked at a little local hospital in the Miramichi. And the first year I worked there, I worked in the stores department, and I was delivering paper and supplies and IV bags to all the different departments in the hospital. And I was very interested in this guy. His name was Garth Miller in the Miramichi, and Garth was a respiratory therapist. So I got to talking to him and what he did. And the next year, I had the opportunity to actually work in his department. So that was between my third and fourth year university. And that was part of my job, or not my job, my school application to the School of Respiratory Therapy was the fact that I was so interested that I worked in a hospital already. So I had a little step ahead of some of my classmates. So as you heard, I had high school diploma. I went to UPEI, I got a degree. I didn't need my degree in order to get into the program. I could have gone directly out of high school into the program, and that's still one option today. Although the more qualifications you have, of course, the better success rate you have of getting into the program. At the St. John Regional Hospital, actually the New Brunswick Community College in St. John, that's where they have the School of Respiratory Therapy diploma program. It's a 3-year program. Or you have an option of going and starting a Bachelor of Health Science at UNBSJ, major in respiratory therapy. So you start, do a degree, do a first year university degree, then get into the School of Respiratory Therapy, do 3 years there. You graduate from that program. You can work as a respiratory therapist once you complete that diploma program, or you can do a 5th year and graduate with a degree in health sciences, respiratory therapy. So there's many different options of how you approach your education into the field. But the education that you get at school is only the beginning. I have, after completing my program, I have gone on and I've done programs where I now teach basic cardiac life support to all hospital staff. I teach advanced cardiac life support to all hospital staff. And when I say all hospital staff, that's doctors, nurses, um, anybody that needs those programs, LPNs, anybody. I took a course or a year-long program. I'm a certified asthma educator. I'm a certified COPD, chronic obstructive pulmonary disease educator. I went to Ottawa and did a program in tobacco awareness and tobacco cessation counseling. So I do programs in that. So yeah, the diploma or the degree program is the start of your education, because after being in this course for 35 plus years, I feel that I'm still learning things every single day. I was reviewing a patient this morning who has lung cancer and who's on oxygen, and I've known this person for quite a while. And when I was reviewing his latest tests, even the doctor, the respirologist, the lung doctor who was writing his note on this patient, was using some terminology that I had never heard before. I laugh because this lung doctor, this respirologist, he was born after I started in respiratory therapy. So it makes me feel old, and I get my gray hairs, honestly. So just to give you a little idea about Horizon Health, as you know, we work in hospitals. But no, we don't just work in hospitals. We work outside the hospitals as well. In Horizon, we work in clinics, community health centers. If you're like, there's a lady that works in Fredericton, her name is Allison, and Allison is an asthma educator, and she works out of the Woodward Center. So she does nothing but testing and education for people with asthma all day long. And some people might ask me, Brad, what do you use most in the run of the day? And I say this thing, my mouth. Education is the biggest part of my day, educating staff and educating other patients about their disease, about how to manage their disease, and developing a plan to move forward with their disease or their condition so that they can recover from it. So in my career, I started out in St. John. I was a staff respiratory therapist. I worked 12-hour days. I worked 8-hour days. I worked 12-hour nights, weekends, holidays, everything. Then I, on the side, worked for a home care company doing oxygen in people's homes. The company was called Ford's All Care. I don't think it's around anymore. And then I had the opportunity, they were starting the New Brunswick Heart Program. So I had the opportunity to go into the operating room and assist the anesthetist, the guy who put you to sleep, guy or girl who put you to sleep. So I would set up all the different intravenous's, all the monitoring, and assist the anesthetist to put those lines in you and put you off to sleep. I was there staring over the sterile field, looking at the heart that's beating away, or when it wasn't beating. In the operating room, there were people called perfusionists, and I'll talk about that a little bit more later on. They were respiratory therapists who went on to do an extra course in perfusion, and they ran the heart and lung machine that kept the body alive while the surgeon was doing whatever procedure on the heart. When I did that way back then, there was no concise program for it. It was on-the-job learning sort of thing. Nowadays, they have what they call anesthesia assistants. So there's a course that you take and you study the very specifics of what, I guess I was in the fledgling part of that program, all on the job training, versus they had classroom portions, assignments, a little bit more detailed. But I taught some of them before I left. So I did that. I had opportunity to act as an assistant manager when I was in that position. I worked in a department in the hospital where we did nothing but put the light down into your lungs. They call it a bronchoscopy. It's a fancy word. So the doctor would put the light down into the lungs, and I'd assist the doctor doing that. And there are respiratory therapists who do nothing but that all day long, work in a bronchoscopy suite or operating room all day long. And then it's amazing what you learn and what you can take away from that in order to help educate the patient after they've had their procedure done. So Horizon gave me that opportunity. And then in 2000, I left that area and I was seconded, or basically I was loaned to the St. John School of Respiratory Therapy, where I was a clinical instructor for a year. So I taught respiratory therapy students about different areas of their training. Then I left and I came up here to Perth Andover, where I've been working out of the Perth Andover Hospital, Hotel Dieu Hospital, ever since. In this role, I've had opportunity to work at the Community Health Center in Plaster Rock. I have worked with the extramural program. I've worked in Waterville Hospital and, of course, worked here. And I've done courses in all those places. I've seen patients in all of those areas. And I've done a lot of teaching in all of those areas. Let's see. So Horizon has great opportunity in all areas for a respiratory therapist. I gave a presentation last month. I actually not gave a presentation. I went into different schools in the area, and I was telling students that came up to my table that there are currently 25 vacancies for respiratory therapists in Horizon, part-time and full-time jobs. So when these students graduate every year, they can have the potential of getting a part-time or a full-time job in Horizon, should they choose to stay in the province. And in the next 5 years, I'm one of those people that are going to be retiring. So there's about another 25 respiratory therapists within the next 5 years who have the potential of retiring. I'm going to be retiring when I turn 60. 4 or 5 interesting careers which I wish to highlight. Well, I'm going to get into that a little bit more when I do a PowerPoint in a moment. As a respiratory therapist, you're going to study a lot of technical things. So physics is a big part of what we do. And of course, anatomy and physiology. Yes, I use a stethoscope to listen to people's lungs, to listen to people's hearts. I assist physicians a lot. I'm just going to remind everybody to please mute their microphone. There we go. Perfect. So to elaborate on that, just this weekend gone by on Saturday, they called me in from home. I do standby hours. I'm on call for the hospital. So they had this gentleman who had a collapsed lung because he had a punctured lung. And so I came in and I helped the physician put one of these funny looking things, which we call a chest tube. So this much was sticking inside the patient's chest. This part was sticking outside the patient's chest. And just the procedure of putting it in there, I assisted the patient. And then I saw that same patient yesterday. His lungs still hadn't fully re-expanded, and he's coming back again today, and I'm going to see him again today. And so I'm part of the team that will assess this patient. And by team, I mean nurse, respiratory therapist, and physician, and those that do the x-rays. That's part of our team. And we're going to decide if his lung has healed to the point that we can safely take that tube out and he can go along his merry way or not. So we'll see about that later on today for me, or anyways, I'll see that. One thing I wrote down here, just some of the things that I've done so far today in my job. So I calibrated the machine. As I said earlier, machines are a big part of what I do. I reviewed the chest x-ray of the patient with lung cancer. I talked with the nursing staff about this patient that's going to come back in with that tube in their lungs. I prepared because not tomorrow, but the next day, I'm teaching 4 nurses this course in advanced cardiac life support. So not just CPR, but about the advanced drugs that we give and the advanced procedures that we do for people whose heart may have stopped. And I prepared to talk to you guys as well. So that's just some of the things that I've done so far this morning as part of my day. This afternoon, I'll be doing breathing tests on people that I've scheduled. Remember that in my facility, just because of the cutbacks that have gone on. And actually on my PowerPoint, my last slide, you'll see what happens to this building after the flood or during the flood that we had in Perth Hanover in 2012. There have been a lot of cutbacks. There used to be 2 full-time respiratory therapists here. Now there's just me. And when I retire, hopefully they'll be able to hire another person in the position and they'll continue on. If I worked in Waterville, there's a team of usually 3 or 4 RTs that are working down there in any given day, Monday to Friday, and 1 or 2 on nights, and 1 or 2 on weekends as well, on the weekend days. If you work in a larger center like St. John Regional Hospital, you might have 10 respiratory therapists that you're working with on days and nights. So for me to work here, yeah, I got to know a lot more because I'm it. It's great. And sometimes they'll say, you know, in order for Brad's job to be posted, the person who's going to fill in his shoes will need a good 5 years of experience. Well, I've got 35 years of experience at least, and I still don't think I know it all or know enough, but I'm still reviewing every day. I look at things that I have in my office and I'm like, okay, time to review that. I may not have used it for a while, but I know that I someday will be using it. So I'm going to share and see if I can do this correctly. I'm going to share my screen. And see if I can go to my PowerPoint. Get that up and going. Come on, PowerPoint. I'm just going to ask Peter, can you see that okay?
Yeah, absolutely.
Okay. So what is a respiratory therapist and why would I want to be one?
Okay, so basically, we're on muted.
So a respiratory therapist, as you see in this little mock-up diagram picture that you see there, we are people who breathe for people. By that, I mean we can monitor their breathing. We can, if they're not breathing on their own, put devices down into their lungs that we can attach to machines that will breathe for them. And then we assess whether those attachments that we've done are in the right place. Come on, advance. There we go. So we're healthcare professionals. We use a lot of technology, as I've said earlier. We care for everybody from the day they are born to the day they pass away. In Waterville, every single birth that occurs in Waterville, a respiratory therapist attends that birth. And the newborn, if they're having any difficulty with breathing, the respiratory therapist is there to assist, to monitor. If they need to go on life support, they do that. If they need chest compressions, they do that. We are part of that vital, critical day 1, hour 1 team. As you can see there, children, adults, elderly. Some respiratory therapists only work in pediatric hospitals. A classmate of mine went to the Janeway Hospital in Newfoundland, and I remember her telling me stories where she would get on a plane, fly to northern Labrador, get on a helicopter, go into a remote community, get a newborn, and reverse her travels back to the Janeway again because that newborn was having difficulty breathing. So she had a very exciting start to her career. As you see there, adults and elderly, we do deal with people that are improving. We also deal with people at the end of life and how to help manage them. As you see, we're part of the Code Blue team, so somebody whose heart has arrested or who's stopped breathing for whatever reason. Trauma team, yep, in my profession, you're going to see blood, guts, and lots of tears. It is just part of our job. If you choose to continue working in a hospital, you'll see down the road in some of my other slides, you could go into nothing but sales. If you chose, okay, I want to do nothing but sell respiratory therapy equipment. There are companies out there that hire respiratory therapists to sell their equipment. And you see high-risk transports there in the bottom of the list. I've had times where I've gotten out of the back of one ambulance, never came back into the hospital, went back, turned around, and got into the back of another ambulance. So I went out with a patient, came back in the ambulance, jumped in another ambulance, took that patient away. So yeah, we're needed, to say the least. Some respiratory therapists have a Bachelor of Health Science degree, some the diploma, and as I described earlier, you can do the 3-year diploma program or the bachelor program. You saw that I teach a lot of these courses, the Advanced Cardiac Life Support, but all respiratory therapists have that program. Advanced Cardiac Life Support, Pediatric Advanced Life Support, NRP, Neonatal, Basic CPR. Not all respiratory therapists have that respiratory educator part. That's when you're educating people about asthma. We have special training for that and special training for chronic obstructive lung disease. I am licensed with the New Brunswick Association of Respiratory Therapists. They can take my license away from me if I do anything wrong, if I go against any of their licensing program. The Health Professional Testing Center, every respiratory therapist writes a national exam. When you complete that national exam, if you're successful, you can work anywhere in Canada. Okay, and the Canadian Society of Respiratory Therapists govern us to work anywhere in Canada. So the life flight at Nova Scotia, you see there, at the time, you heard Peter say that I was in one of those Chinook helicopters. I was in one of those monstrous big double prop ones from the military, and we were taking a kid from St. John, an infant that was just born with a heart defect, from St. John to the IWK in Halifax, and we took them by the life flight, but it was the Chinook helicopter at the time. That was fun. It was very interesting because a medic who came from the military, when we were, it was their policy that when we took off, he had to control the patient's breathing. It was their policy. He looked at me and he said, "I've never dealt with somebody this small before. You can take over." We both had a little chuckle about that. I still remember that. So as you heard me say, we work in community health centers. I work in the one in Plaster Rock, but any community health center in the province, respiratory therapists work in those. Primary health care, home health with extramural. Private companies, you heard me talk about some companies do nothing but sell equipment out there. Some companies like Meditech do nothing. Right now they have the contract with the province where they supply all patients in the province who need oxygen through extramural. Meditech, respiratory therapists work with that company, and they go into people's homes with oxygen. And the high-risk transport units. Some respiratory therapists are on call for nothing but these life flights. So what do I do in the run of a day? Critical thinking, very big part of my day. I'm not just dealing with somebody's lungs and nothing else. I've got to be part of the team that's trying to put the big package together and find out what's going on with the patient. Ventilators or life support machines are part of what I use in my job. Oxygen delivery devices, there are hundreds, if not thousands, of different ways that I can give you oxygen. And I have to choose which is the best way for you depending upon your condition. Airway management devices, I'll show you a few things when I get done this PowerPoint that will help us, help you see, okay, that's kind of exciting. I find it exciting anyways. Anesthesia gas machines, those people that do anesthesia assistance are highly involved in monitoring and maintaining those things. Medication delivery devices, we'll talk about that. I work as part of the team. I don't work alone when I'm dealing with a patient. I am perhaps doing a breathing test on somebody, getting a report, but the physician, the nurse practitioner, other staff take my information and they apply it to the patient. And then we come up with a plan as to how we're moving forward with this patient. Education. Yesterday, there was a allergist who works here, Dr. Carson, and she sent me a patient who she thought might have asthma. So I did a test on the patient, discovered a few things about the patient, and then sent that information back to Dr. Carson, and we came up with a plan as to where we're moving forward with this patient. And the mother was with this gentleman, and we did a bit of education while we were doing the breathing test. I teach. Boy, do I do a lot of teaching. I teach other respiratory therapists, paramedics, nurses, physicians, all allied healthcare. I'm involved in teaching with them. As you heard me say earlier, I work any day, night shifts, weekends, holidays. That is part of my job description in Horizon. Lots of autonomy. Yeah, as you heard me say, I work alone. Other places, you have other respiratory therapists that you can bounce ideas off of or talk about a plan for a patient. Me, I do a lot of that myself, I guess is the best way of saying it. But yes, I'm still talking to the patients and still talking to the staff about what I plan to do with the patient. I don't generally bounce my ideas off other respiratory therapists. No 2 days are the same. Boy, is that true. Even giving this talk right now, I might be called away to an emergency in the emergency department. But being a single respiratory therapist in this building, yeah, that's a possibility. I could be in the middle of a test for a breathing test and have to be called away to emergency. So that happens in my job profession. In another building like St. John Regional, there are 5 other respiratory therapists who could respond to the cardiac arrest. I might not have to go. Latest techniques and technology. Yeah, I still do a lot of online education. I still travel down to Fredericton and Waterville to get more education about new procedures that are going on. I was down just Halloween, I think I was down and listened to a lung specialist give a talk about these new biologics, they call them, these new drugs that are injected that help people with asthma. So I'm part of a union. Yep. My union has negotiated with the New Brunswick government. Right now, I just looked at my pay stub so I could answer this question. I make $40.94 an hour. Mind you, I've worked a long time, so I'm at the top of my pay scale, right? My manager makes even more than that. She makes in the 45 plus per hour category. If you were hired to work, let's say in Waterville or in Fredericton, you might get a $10,000 sign-on bonus for if you commit to work there for 1 or 2 years, you would get a $10,000 bonus. When I graduated and started working many years ago, I got a $15,000 sign-on bonus. So depending upon where in the province, yep, there's great incentive to stay in the province. Perfusionists, the top right-hand picture, you see all these bloody lines. So these people primarily work in an operating room. They also work in intensive care units. If any of you ever heard of the fancy word called ECMO, extracorporeal membranous oxygenation, if your lungs can't do all the breathing for you, but your heart's still pumping, then sometimes they'll put you on this machine called an ECMO, and a perfusionist runs, monitors, manages that machine. The picture that you're seeing on the top right-hand side is when we're stopping your heart, but keeping the blood going through the rest of your body. The perfusionists run those machines. Anesthesia assistants, a friend of mine that I used to work with in St. John, Peter puts people to sleep, but still breathing, still has a heartbeat, but when they do special procedures on them, he is there. He's under the supervision of an anesthetist, but he has done that advanced training that allows him to give intravenous drugs, that allows him, as you see in that lower picture, to perhaps put a tube down in somebody's lungs after he's sedated them enough. So some respiratory therapists do nothing but work in research. Government departments and programs like the New Brunswick Lung Association has hired respiratory therapists to help run some of their summer camps. You heard me talk about me doing the community college education many years ago. And as you heard me say, my manager makes more money than me. Respiratory therapists do move up through um, the pay scale and do management in hospitals. There's a guy, his name is David Arbo. David Arbo was a respiratory therapist. I did his first job interview in St. John many years ago to work as a respiratory therapist there. He and his wife eventually moved up to the Perth Andover area. He became the first tobacco cessation coordinator. Then he became a manager for extramural. Then he became a manager for the entire Waterville Hospital. Now he's the CEO for the Fredericton and Upper River Valley zones. So you can see where he's come a long way. He's an extremely intelligent man, but that he started as a respiratory therapist. So anesthesia assistants again, training in the care of patients receiving anesthesia. Anesthesia assistants have gone on to do approximately 2 years further study after they, well, an RN, a nurse can become an anesthesia assistant, but a respiratory therapist as well. I'm going to show you a little video here now that is put out by the Canadian Society of Respiratory Therapists.
Respiratory therapists breathe life into healthcare, helping a baby take its first breath, helping a child get back to the activities they love, supporting a parent until they are able to breathe on their own again, helping a grandparent manage their COPD. Working on the front lines of the COVID-19 pandemic, respiratory therapists are there. And when a life is on the line, they are there, providing critical care, managing ventilators and other life-supporting equipment. Respiratory therapists are there for you, your family, and community wherever and whenever you need them most. These dedicated professionals provide essential care to patients of all ages to help them breathe easier. They use their specialized knowledge and clinical expertise to work with you, your family, and other healthcare providers to plan and deliver safe and effective care. Care that gets you back to living life to the fullest. Respiratory therapists, also known as RTs, stay at the forefront of all available research and technology. They are experts in cardiopulmonary health and the management of lung diseases. You can find them in hospitals and healthcare clinics, in the community, and in the home. They help diagnose and treat all types of breathing problems, help you use a wide range of medications, and will help you monitor and manage any challenges you may have with respect to your health and well-being. The Canadian Society of Respiratory Therapists is proud of the work RTs do every day and is there to support them. Working together in your community, across Canada, and around the globe, they advocate for patients and develop tools and resources to ensure the highest quality of care is always available. For more information about how RTs breathe life into healthcare every day, or to learn more about the Canadian Society of Respiratory Therapists, please visit csrt.com. Respiratory.
So my wife is forever telling me that I'm not going to retire when I'm turning 60. She says, "You love your job too much, Brad. You're going to keep on doing it somehow." Well, I hope to retire when I turn 60. And as she says, I love my job. I have absolutely zero regrets about the profession that I've chosen and working in healthcare. Is it fast paced? Yes. Do I get reimbursed for my day? Absolutely. Is it challenging? Every patient is a challenge. Are there still exciting opportunities? Am I still excited about the rest of my day? What's coming tomorrow and the next day? Absolutely. As you see, there are we're in demand across Canada. You heard me say that there are schools everywhere across Canada. Saskatchewan, because they haven't had a school in the past and they always relied upon other schools across Canada to supply them with respiratory therapists, there was such demand for respiratory therapists, they had to get their own school going, or else they would never fill all the job opportunities that they had in their province. It is an awesome job, to say the least. This is a picture you can see the Irving in Perth Andover. It's not in Irving anymore. That's the bridge in Perth Andover in the background. A nurse and I were the last vehicle allowed across the bridge before they closed it. We were taking a critical patient out of the Perth Andover Hospital. When we came back, I was stuck on the other side of the river away from the hospital, and they said, Brad, we need you back here now. And this is the Zodiac from the Perth Andover Fire Department that is bringing me back to the hospital through the floodwaters. No, I wasn't scared. It was fun. Not really. It was fun, though. All right. I've talked enough. Any questions for me?
Yeah, if you have any questions, feel free to put them in the chat. I have one just while we're waiting, Brett. Did you always know you wanted to work in healthcare, or was there an experience in particular that kind of guided you in that direction? Or yeah, just curious.
So no, I didn't know that I always wanted to work in healthcare. As I alluded to earlier, when I was a student between university years, I had the opportunity to work in a summer job in a hospital. And from that experience, then I found by talking to other healthcare professionals, I decided upon which one I liked the best. When I was going to university, I had no idea what I wanted to do. Absolutely none. I knew, I wanted to advance my education, but what I wanted to settle upon, no idea whatsoever. Even my youngest son, who is now a teacher, he did his first degree in kinesiology. Then he went back for a 5th year and did his degree in education. He wasn't sure exactly what he wanted to do. I like to hope that one time when he attended a talk I was giving to the Operating Room Nurses Association in New Brunswick, he had to tag along with me because I didn't have a babysitter, and he saw me up on a stage giving a talk to a bunch of people, and I hope that I inspired him to further his career in education.
Great.
So I encourage people, and that's one thing that there's a program that Horizon has called Pro 150, and it is if you think you have an interest in healthcare, you can contact Horizon Health on their website. There's a link, and you can get opportunity to job shadow a respiratory therapist, a lab tech, a nurse, whatever, and get a little idea as to what that job entails. December 2nd, there's a group of students coming from the Perth Andover school, and they're coming, and we're doing nothing but giving a little talk to these groups of students on what each of our professions are. To take advantage of something like that, that would be great, I would think.
Yeah, for sure. I have another question for you. How long does it take to get full-time employment in the field currently?
So if you graduated from the School of Respiratory Therapy today, you could get a full-time job. You heard me say earlier, there are 25 full and part-time jobs currently vacant in the province of New Brunswick's Horizon Health. Now, you add Vitalité to that. Right now, in Grand Falls, there are 2 respiratory therapists. Each week, one of those 2 go to the Edmundston Regional Hospital to help out with the workload there because they are short for respiratory therapists there. And that's almost right across the province. You can get a part or a full-time job. As you heard me say, there are 25 vacancies.
Okay. Any other questions for Brad from any of the classes on the call? It's probably getting close to lunchtime for some of you here.
I'm surprised with myself. Peter didn't have to interrupt and say, okay, Brad, stop talking.
Nope.
Usually I just keep going.
Well, if there are no questions from the group, I think you probably just answered a lot of them. I had some and I was checking them off as you kind of answered them along the way, which is great. But definitely appreciate your time today, Brad, and the information session was very helpful, and Thank you for all the classes who joined in as well. And again, if you don't mind just taking a moment to, if you haven't done so already, just enter in what school you're from and how many students are on the call, just so we have an idea. But thanks a lot, Brad. I appreciate your time, and look forward to chatting again soon.
Great. Thank you. Have a great day, everybody.